Hi guys, welcome back to my channel. My name is Tisha. For those of you who are new, thank you so much for tuning in. In today's video, I'm going to be talking about nurses and how we are trying to protect ourselves in this pandemic that's going on. As you guys are already aware of, this virus is affecting a lot of places, a lot of countries, and a lot of people are being taken into quarantine on a daily basis. So I want to discuss what nurses do whenever they're working. They could be working at the hospital, in the community, at the nursing homes, rehab centers, clinics, whatever. So I'm just going to show you guys what I carry in my nursing bag. This is a nursing bag video. So I hope you guys can take away something from this. Maybe you guys can be a little bit more aware of how we're trying to protect ourselves, being that we're in such serious times right now and this coronavirus. So I'm just gonna show you guys what I carry in my nursing bag, and if you guys do have any questions, let me know in the comment section below. You can follow me on my social media at TishaLove1. That's on Instagram, and that's the same thing for Facebook as well. And without further ado, let's jump right into the video. So what I do at first, I usually carry two bags with me. I usually carry my regular bag. So I have a regular tote bag. This is from Calvin Klein. This is like my everyday bag. And I do carry like just another basic bag where I do keep some of my necessary supplies or anything that I need if I'm going on a certain ward. So I'm just gonna start off with what's in my nursing bag at first, because that's what this video is about. Okay guys, so the first thing I'm going to show you guys is hand sanitizers. And as you guys know, hand washing is so essential, and sometimes you don't really have access to running water or maybe like soap to wash your hand. Another tool you can use is hand sanitizers. We usually get in services at the hospital where it helps you to they show you how to use hand sanitizers properly. So this one is a gel hand washing. It's for healthcare professional hand wash. So I hope you guys can see that. So this is pretty good. So just a little demo. Whoa, a little spill there. So you just put a little in your hand there, and then you just rub. What we do, we always get the tip of the fingers, always get on your hand there, always get around your thumb, and you can go in between your fingers. And you can do hand sanitizers the same time as you're doing your hand washing, which is about 20 seconds. But I always recommend always rub your hand until you feel that the hand sanitizer is completely dry. So that's a tip for you guys. I do also carry around other hand sanitizers with me as well. This is the Ecolab hand sanitizer. I carry that as well. That has about 70% ethyl alcohol. Also look for hand sanitizers that has those type of ingredients. The other thing that I want to show you that's in my nursing bag is I have a digital thermometer. This one is actually in a case. I haven't opened this one yet, but I do still carry it around with me, so in case of like any type of emergency, I can always like pull it out and have access to it where I can check temperatures very, very quickly. And it's so convenient because it's a small size. I also carry some masks, and the thing with these masks, like these people have to also realize that these type of masks, they're not respiratory protective masks. These are just regular masks that we might put on patients that are infected if they're trying to come out of isolation. we put that on the patients, but sometimes you can put that on yourself if you're trying not to touch your face. I think there's a lot of misinformation out there because people think that it protects you from actual germs around you. These masks, they can still, like, you can still have germs that escape through the mask. There's also a special type of mask that's definitely respiratory mask that you can we get training for that every 2 years as health professionals to make sure that in any type of outbreak or any type of respiratory viruses that's going about, we have to update those masks every year to make sure that when a pandemic is happening that we have it. And I'm going to show you guys that type of mask later on in the video. But these type of masks, they do not protect you against any respiratory viruses. They only have temporary protection if you're trying not to touch your face, trying not to touch your nose and your mouth. If your hand accidentally touch your face, then this is like a safeguard for you. We only put these on patients if they're trying to come out of isolation, trying to maybe go outside of their room, so we'll just put that on as a precaution. They're both 3 milliliter syringes. I still carry these around in any type of emergency situation. I still carry that. Also, needles. You can attach these needles onto the syringe in any type of situation if you need to give any type of emergency medication, if you need to administer anything through an IV, if there's liquid medications and stuff like that. So just emergency precaution. These are some more needles. We do have alcohol prep if you're in a situation where you need any type of sterilization, if you're dealing with any type of open wounds, any type of skin irritation and you need some sort of protection. I do carry around alcohol prep. This just helps the skin to get rid of any outside bacteria that's on the wound, or any type of skincare or any ulcers that are there, and then you can add any other agent to the wound. So I do carry that around as well. So these are epinephrine. So epinephrine medications. These ones, you just open the tab right here and it just opens up, and then you can draw the medication from the syringe that I show you guys with the needle attachment. So these are just for emergency situations. And as I said, because I also work in the community, I have to have them with me because we need our own supplies in case the patients don't have it at home. This is a PPE kit. This one, you have a surgical mask, you do have hand sanitizers. I already showed you the hand sanitizers that I do use. Goggles, it has safety glasses, things like that if you're in any type of surgical procedure, if you are doing catheterization, anything that involves liquids, bodily fluids where you think that it can be splashed around you. These are really good to have. So this is goggles. So I carry these around with me as well. Gowns are really good to have. I don't have any gowns right now. I need to stock up on some gowns, but I don't have any gowns with me right now. But just to give you guys another heads up, these are just to cover the shoes, so no bodily fluids goes on your shoes as well. And also when you're dealing with blood as well, you can also wear PPE depending on the type of situation you're in. If the blood is infected and things like that, then you definitely need to protect yourself. So I wanted to show you guys the mask that I was talking about. So they are called the N95 mask. So these masks definitely protect you as a healthcare provider if you're if you're having a patient that has like any airborne illnesses. And these masks, though, it goes by size. So in the hospitals or wherever you are, nursing home, in the community, wherever you work, they have to retest you every 2 years to make sure that you have the right mask all the time, because you know, as you get older, as you're maturing, the size of your face can grow wider, it can get slimmer, whatever. So just to make sure that you have the right size for you, everyone is different. The hospital policy or healthcare policy, you have to get tested for these masks every 2 years. So this is how it looks. And I'll just show you guys the so it's N95. So they normally call it the N95 mask. So if you're dealing with a patient, just so say for example, if your patient has TB, tuberculosis, like those type of conditions, they're airborne conditions, so that patient needs to be in a specific room, like a negative pressure room, where all the bacteria and everything, it lingers within that room, it doesn't go outside. So that's the negative pressure. Whenever you're taking care of these type of patients, you need a special mask. This is the N95 mask. So this is the mask that they're talking about. So there's different levels to it. So you have the regular mask, you have the respiratory mask, which is the N95. So I do have 2 of them with me as well. A Voltaren, I actually stocked up on this today. As a nurse, we have to do a lot of lifting, even though there's equipment and supplies that help us with certain patients who are overweight. We have the Hoya lift and stuff like that, but sometimes in emergency situations you don't really have time to put everything together. Sometimes you have to work as a team to transfer that patient. And also we do a lot of bending. Our job is very demanding on our body, so we have to practice a lot of body mechanism. So one of the things I always walk around with me is the Voltaren Emugel, because it really helps. It's like a topical pain medication. So it doesn't work like a pill, it's like an ointment. You just put on your joints if you're feeling pain, joint pain, back pain. I do suffer from a lot of shoulder pain, so I definitely bring this with me as a protection and as like a self-medication. For me, anytime I do feel any type of pain, I do bring this around, and this has been a lifesaver for me over the years. Like, I've been in healthcare now for almost 8 years, and this is like heaven. You cannot leave your house without a stethoscope. If you're a nurse, sometimes I would be on the ward and I would see nurses without their stethoscope, and I would be like, you know what, you should go home and come back to work again. Because I hate it when nurses come to me and they're like, oh Tisha, can I borrow your stethoscope? No, this should be the first thing that you run to. Okay, so never leave your stethoscope at home. I always bring it either in my bag or I would leave it in my car, but I never leave my house without it, because this is like a lifesaver for nurses. This is like what should I say, this is like the backbone, right? Like, you can detect so many things by just listening to the lungs, listening to the heart, listening to bowel sounds in the abdomen. There's so many things that you can do with the stethoscope. It's definitely a lifesaver. I use the Littman quality stethoscope. There you go. Yes, so I use the Littman stethoscope, and I got it in an orange. They come with like a variety of different colors. And if you're a new grad and you're getting hired somewhere, never ever go without using a stethoscope. Any new grad that specializes in medicine, and also if you're interested in pediatrics, if you do have any questions, just leave them in the comment section below. Good luck to everyone, stay safe. And also with this coronavirus, remember the 3 signs to look out for. If anyone has shortness of breath, if you are having difficulty breathing, that's the first indicator. If you have a dry cough, or if anybody have a fever. So always look out for those 3 signs. Stay safe, use your hand sanitizers. If you don't have access to a hand sanitizer, always wash your hands, and wash your hands for 20 seconds or more. Once again, thank you guys so much for watching this video. Give me a thumbs up, and you can share with your friends who are misinformed about this virus. And I will see you guys on my next video. Bye guys.